So it's really up to the individual and whether or not they fall within the population groups that the CDC has outlined. So we do ask that people read that guidance carefully before they schedule the appointment with us to make sure they have all the information that they need. Now that we have 3 vaccines available for booster doses, it's even more important that people really read the fine print closely. For instance, on the Johnson & Johnson booster doses, they may be given at least 2 months after the first dose, but for Pfizer and Moderna, it's 6 months. So the guidance does vary. So unfortunately, it's not one size fits all. With that said, we will be asking the necessary questions to help ensure patients get the appropriate administration. We do ask that patients bring their vaccination card just to help us verify that information and make sure that they get the appropriate vaccine when they're here with us. If a patient's lost their card or they didn't get their first shots at Novant Health, then we ask that they contact their original vaccine site for more information. We will be able to access the records of anyone who received their first dose at a Novant Health location, and we can also replace their card if needed.
Yeah, so what I would say to that is there's not a huge rush to get the 3rd dose. And because essentially if you've had 2 doses of an mRNA vaccine and you've had COVID, you essentially have had 3 doses. So actually getting COVID is going to increase your neutralizing antibody again because your memory B cells get activated. So there's no rush to do that. People can do it within a couple of weeks if they want to. But I've encouraged people, if you've had 2 doses and COVID, that there's no need to rush out and get a booster dose at this point. Consider yourself as having 3 doses then.
It remains to be seen, but I do expect a pretty high peak, and then I expect it to plateau out, much like we saw with when Pfizer guidance came out, and those that had received a Pfizer original series were more than 6 months out, and then the immunocompromised guidance, we did see a peak. So I think we'll continue to see that. I think there's lots of interest out there, and we'll continue to review how we're doing with appointments and access, and we'll shift operations to match whatever the community's demand is.
I think the way we have to think about this is when you get 2 doses of mRNA vaccine and you're under the age of 65 in particular, you're very well protected still, even with Delta variant, from hospitalization and death. What happens over time is after you get those vaccines, your neutralizing antibodies decline. But your memory B cells are still around that can get fired back up to protect you. So when you get the 3rd dose, you're probably not gaining a lot of benefit in terms of preventing hospitalization and death. You are getting some benefit in preventing any case of COVID, even a mild case, because now you have more neutralizing antibodies around. If you don't get the 3rd dose and you get exposed to COVID and you get it, it does take a little bit of time for your memory B cells to get fired up again. So hence you may get a mild case, but that 3rd dose under the age of 65 is really to kind of prevent you from getting COVID at all, more so than it's really increasing your protection from hospitalization and death. Now, when you're over the age of 65 or you're profoundly immunosuppressed because you've had an organ transplant or uncontrolled HIV or on chemotherapy, those kind of things, then yes, I think getting that 3rd dose is more important because you generally don't respond to vaccines in the same way. So like I said earlier, the data around this 3rd dose is really the best in over age 65. I think if you're younger and you've had 2 doses, you're very, very well protected. If you fall into the category to get a 3rd dose, I think it's reasonable to do so, but really consider it strongly if you're over age 65.